You know everybody.
Yes, sir.
They know you as well as anybody. Why don't you give a little presentation?
Absolutely, yes, sir. So NASA's been hard at work, part of the whole of government approach to combat the coronavirus. And so a lot of our workforce has been staying at home, as has been the guidance. The question is, what do you do with rocket scientists when they stay at home? Well, what they do is they build amazing things. And in this particular case, I've just got 3 to showcase here, but there's so many others that we could talk about. But I'll just go from left to right, Mr. President. This is an oxygen hood. So a person who has coronavirus, we want to make sure that they have pressure for their lung with 100% oxygen. So we put this hood on them. And we also want to make sure they're not shedding virus at the same time. So it protects the healthcare workers that are working on the patient. So this is it's an oxygen hood. It was created by scientists at the Armstrong Flight Research Center in California, in conjunction with with what's called Virgin Galactic, which is a commercial company that will be launching people to space, suborbital space, straight up and straight down here, in just a very short period of time, just commercially, tourists, if you will.
So that's going straight up, a little whatever, and then straight down.
Straight down, and it's a commercial enterprise.
What's the level of safety of that?
I think it's very safe, and if you ask them, they'll tell you it's very safe. It's Sir Richard Branson's organization. He took it public, so it's now publicly traded on the New York Stock Exchange, and they're getting customers very rapidly.
How high up do they go?
They go up to about 50 miles, over 50 miles as a matter of fact, straight up.
And do they immediately come straight down?
They do.
Or do they tour around?
They'll get about 10 minutes of weightlessness before they come back to Earth. So it's not so much of a tour around, but just a period of time where you get to experience weightlessness.
Would you do it?
I would absolutely do it. Are you kidding? In a heartbeat. And in fact,
I'll pass.
NASA actually contracts with them for experiments. So we take experiments up from periods of time. Now this red box, sir, is something you're going to love. And I mean, it's impressive. NASA has this technology. When we launch a robot to Mars, which as you know we're going to do here in July, when we launch a robot to Mars, we have to sterilize the robot. We have to make sure that there's not a microbe on the robot, because we don't want to accidentally put a microbe on Mars, because we want to make sure anything we discover on Mars is something that was already there. So here's what this does. We took that technology to sterilize a spacecraft, and we said, how do we use it to sterilize the inside of a room? And that's what this device is, Ambustat. So think of it as a fogger. It will fog the room, and every surface in the room will then be sterilized. No coronavirus. So we use it right now. It's NASA technology used by ambulances, but now we're going to use it for the inside of schools, the inside of prisons.
So people can breathe this in?
It'll take about an hour, and after the room is clear of the fog, think of it as an atomized sterilant that touches every surface and guarantees that there's no germs. That's what we're doing with this. We've been using it in ambulances now for a while. Now we want to take it and use it to sterilize entire rooms so schools can open and businesses can open.
So it's emptied out, and then you would do it?
Yes, that's right.
Do you turn it on remotely or not?
You just bring it in a room, set it down, let it fog, and then every surface ends up being clean. And people can go back to work knowing that their workspace is clean. And it doesn't leave a film on any of the surfaces. You don't have to wipe down the surface.
So what is it that cleans the room?
It's what we call a sterilant. So think of it as a fog. So the fog goes throughout the room, it touches all the surfaces, and it kills viruses. We've used it specifically for MERS. We've used it for Ebola, and we believe it's very effective, and we're proving it out right now. We believe it's going to be very effective for coronavirus as well.
That's great.
It is, yes, sir. And I'll let Dave Gallagher here from JPL, the Jet Propulsion Laboratory out in California, talk about this. But this is an amazing capability built by scientists and engineers out in California at the Jet Propulsion Laboratory. So Dave, I'll let you talk about it.
So, Mr. President, this is actually a great news story in the midst of this pandemic. When we started stay at home about 4 weeks ago, one of our engineers just could not stand the idea of sitting back and doing nothing with the spreading coronavirus, and came up with a design very rapidly. We built the team, which did a lot of the work remotely, working from home, and in just over 4 weeks have developed a COVID-19 ventilator. It's unique in many ways, and JPL, we build spacecraft, we don't build medical products, and the innovation and creativity of the men and women of JPL, it's incredible. So this thing has about 80 parts. A normal ICU ventilator has about an order of magnitude higher than that.
Right.
These parts are not in the ventilator supply chain. They're kind of regular parts. So we will not, by building these, we will not interrupt the supply chain for ICU ventilators. Most importantly, COVID-19 patients their lungs are not compliant, so you need high pressure. And this is a high pressure ventilator from day one. We got Mount Sinai, doctors on the front line involved. We got the FDA involved. This thing just finished a couple days of testing at Mount Sinai. We submitted it for FDA approval.
How did it do?
It did great. They have the most high fidelity lung simulator anywhere.
So how would this compare to a really high quality ventilator?
So the difference is...
Which is heavily computerized, by the way.
The real difference is a ICU ventilator, a traditional one that you'd find in a hospital right now, is meant to deal with any kind of situation. This is really targeted for COVID-19 patients. And so,
because of the pressure?
Because of the pressure, it's very easy to manufacture. So we submitted the FDA approval, and then just this morning, JPL is operated for NASA. It's by Caltech. And so this morning, Caltech, we went live with a royalty-free worldwide license. And we have, what I hear, hundreds of companies are interested in manufacturing these. They should be very inexpensive to manufacture. I don't want to say...
This is great.
What it is, but it's just a wonderful story.
Really great. What do you think it'll cost to produce that?
I hesitate to say, but it should,
less expensive than
it should be, I would guess, a factor of 10 less to manufacture, maybe
much less expensive.
$3,000, $4,000, something like that.
That's fantastic.
Yeah,
Well,
very proud of our people and happy to show it to you.
Congratulate the engineer, right?
I sure will. Dave Van Buren is his name.
Say hello to Dave.
I
That's
will
good.
do that.
Thank you.
Thank you.
Okay, thank you very much,
All
everybody.
right, guys, come on, let's go.
That's fantastic.
Thank you, sir.
We're
All right, let's go.